The professional medical assistant and the healthcare team. Learning objectives. Lesson 1.1, the professional medical assistant and the healthcare team. What learning objectives are the items that you're going to be learning as you go through this lecture and through your reading materials. Number 1 is discuss the typical responsibilities of a medical assistant and describe the role of the medical assistant as a patient navigator. 2, discuss the attributes of a professional medical assistant, project a professional image in the ambulatory care setting, and describe how to show respect for individual diversity. 3, differentiate between a scope of practice and the standards of care for medical assistants. 4, list and discuss professional medical assisting organizations. 5, examine your learning preferences and interpret how your learning style affects your success as a student. 6, integrate effective study skills into your daily activities. Design test-taking strategies that help you take charge of your success, and incorporate critical thinking skills and reflection to help you make mental connections as you learn the material. 7, summarize the history of medicine and its significance to the medical assisting profession. 8, summarize the various types of medical professionals, allied health professionals, and healthcare facilities. 9, define a patient-centered medical home and discuss its 5 core functions and attributes. 10, explain the reasons professionalism is important in the medical field. Describe work ethics and the stress of importance of cooperation. 11 is apply time management strategies to prioritize the medical assistant's responsibilities as a member of the healthcare team. And 12, respond to criticism, problem solving, identify obstacles to professional behaviors, and define the principles of self-boundaries. Responsibilities of a medical assistant. Your clinical skills would include assisting during physical exam, performing patient screening procedures, performing ECGs and EKGs, they are the same thing, phlebotomy, first aid procedures, and infection control procedures. Then your administrative skills would include answering phones, managing patient scheduling, documenting accurately in patient health records, managing facility correspondence, and follow legal and ethical principles. Now remember that medical assistants are the only allied health professionals that are specifically trained to work in those ambulatory care settings, such as physician offices, clinics, and group practices. The role of a patient navigator. The medical assistants also play a role as a patient's advocate. Care coordination is originated from patient navigator programs. And then the patient navigator positions are commonly called care coordinators. Your positions can be found in the ambulatory care settings and hospitals. Customer service closely relates to professional behaviors. Remember that medical assistants must provide excellent customer service. Now, your customer definition would be one who purchases goods or services. So in the medical field, patients are considered the external customers. Your internal customers, which are actually people whom you deal with in the work environment. And remember, the definition of a customer service is whatever we do for our customers to improve their experience. Remember that great customer service leads to a successful healthcare facility and allows for growth. Goals should be to provide customer satisfaction overall. Characteristics of a professional medical assistant. Professionalism, courtesy and respect, empathy and compassion, tact and diplomacy, respect for individual diversity, honesty, dependability, and responsibility, and professional appearance. Scope of practice and standards of care for medical assistants. With scope of practice is the range of responsibilities and practice guidelines that determine boundaries within a healthcare worker's practices. Medical assistants are not independent practitioners. Medical assistants not meeting expected standard of care may be charged with professional negligence. And the standards of care equals the legal term that refers to whether level or quality of patient service is the same as what another healthcare worker with similar training and experience in a similar situation would provide. Remember, there is no single definition of a scope of practice for medical assistants throughout the United States. Professional organizations for medical assistants. The American Association of Medical Assistants, the AAMA, is the only association devoted exclusively to the medical assisting profession. Other organizations, such as the American Medical Technologists, is AMT, and the National Healthcare Career Association is NHA, not involved in program curriculum standards or program accreditation. Achieving a credential and a continuing education. Being a credentialed medical assistant has certain benefits. It's important to stay current with newest medications, treatments, and diagnostic tests. Continuing education options would include reading professional journals, reputable health websites, on-the-job educational conferences, local, state, and national medical assistant conferences. How to succeed as a medical assistant student. Their learning style inventory. First step is learning new material and perceiving information. And your second step is information processing. Some learners are apt to watch, observe, and use reflection to think about and learn the new material. These students are abstract perceivers who learn by analyzing new material, building theories about it, and using a step-by-step approach to learning. Other students need to perform some activity, such as rewriting notes from class, making flashcards, and outlining chapters to learn information. These kind of students are called concrete perceivers. 4 stages of learning style inventory could include your stage 1 learners have concrete reflective style. Stage 2 learners have abstract reflective styles. Stage 3 learners have an abstract active style. And stage 4 learners are concrete active learners. Study skills, tricks for becoming a successful student. Memory techniques. There's a word called mnemonic, and that's when you use the first letter of each word to stand for something you're trying to remember. Some of this helps when you're trying to learn your medical terminology or word parts and things like that. There's also some tricks could be active learning, brain tricks, reading methods, and note-taking strategies. You want to make sure you come to class prepared. Request copies of slides before lecture, if possible, and create mind maps. Test-taking strategies. Taking charge of your success. Prepare adequately. Control negative thoughts during test time. Understand ways to manage various types of questions. Always read directions carefully. Be aware of the amount of time allotted for the examination and pace yourself accordingly. And your true-false questions give you a 50-50 chance of being correct. Become a critical thinker, making mental connections. Sort out conflicting information. Weigh your knowledge about that information. Ignore and let go of personal biases and decide on a reasonable belief or action. Critical thinking could also be described as thorough thinking. The history of medicine. Hippocrates, the father of medicine, is the one who created the Hippocratic Oath. The 17th century European academics or societies were established, and gradually, administrative part of running a practice became time-consuming and complicated, so physicians realized they needed some help. The first medical assistants started working in individual physicians' offices with on-the-job training. Medical professionals, doctors of medicine. Medical doctors are considered allopathic physician. Doctors of osteopathy, so your osteopathic physicians complete requirements similar to those of MDs to graduate and practice medicine. Doctors of chiropractic. Our chiropractic care is one of the most common fields of complementary and alternative medicine. The hospitalists. Hospitalists are physicians whose primary professional focus is the generalized medical care of the hospitalized patients. Then you got nurse practitioners, and they provide basic patient care services, including diagnosing and prescribing medications for common illnesses, or they may have additional training and expertise in a specialty area of medicine. The physician's assistants are a certified healthcare professional who provides diagnostic, therapeutic, and preventative healthcare services under the supervision of a medical doctor. Your allied health professionals, they loosely refer to those who can act only under the authority of a licensed medical practitioner. It falls into two broad categories: technicians, which would be the assistants, and then you've got the therapists. Your types of healthcare facilities, such as hospitals, primary, secondary, and tertiary levels of care, and your private hospitals are run by corporations or other organizations. Your nonprofit hospitals exist to serve the community in which they are located and are normally run by a board of directors. Ambulatory care are physicians' offices, group practices, multi-specialty group practices, the clinician offices, etc. Other healthcare facilities such as diagnostic laboratories, home health agencies, or hospital-affiliated home healthcare organizations. Your patient-centered medical home, also abbreviated as PCMH. It's a model of patient care. There are 5 core functions and attributes: comprehensive care, patient-centered care, coordinated care, accessible service, and quality and safety. Patient care is looked at from a holistic approach. Research indicates that the PCMHs are saving money by reducing hospital and ED visits, while at the same time improving patient outcomes. The ultimate goal of the PCMH is to improve patient outcomes and reduce costs. Professionalism, having a courteous, conscientious, and respectful approach to all interactions and situations in the workplace. The medical assistant should always display initiative and be reliable. Work ethics is composed of a set of values based on hard work and diligence. All employees must be punctual every day. And if your job in the office is to be the first one that opens up, you might even want to be early and not just on time. Cooperation and willingness to help. Each team member must be willing to cooperate and help others on the team. Through cooperation, team is more productive. Team members have a greater satisfaction, great sense of communication and understanding as a team. Patients are cared for, and great customer service is provided. Prioritizing and time management skills. Methods that maximize personal efficiencies and prioritize tasks. Take 10 minutes to write down the task for the day. Keep it manageable. Use code systems to prioritize your tasks. M must be done that day. S should be done that day. And C could be done if time permits. Responding to criticism. We learn from others' feedback on our performance. Need to realize the value of feedback. Becoming defensive or blaming others is not professional. Problem solving and the chain of command. It's best to talk with the person with whom you are having an issue with. You want to refrain from using sentences that start with "you are." Remove the emotion from the situation. And if the issue is related to theft, confidentiality, or harassment, you may need to follow the chain of command in the healthcare facility. Barriers to professionalism. Remember, at times it's not easy to be a professional, but those barriers to being professional can be your attitude, procrastination, personal problems and baggage, gossip, personal communication, and dating coworkers. Gossip is casual or idle chat, such as rumors about other people and their business. You'd always want to refrain from checking your personal emails when you're at work. And visitors should always not frequent the office. Your self boundaries. It's important to develop a solid professional relationship with patients, establish realistic self boundaries, and protect relationships. And that is the end of the lecture for the day.